we will pay for all your meds, your strips, your co-pays, anything related to you going to the doctor, we will pay for those. But here's what I want you to do. I want you to participate in our program you'll go to the doctor when the doctor's asked for you to come for a routine visit, get your routine checkups done. You'll meet with your pharmacist to make sure that you're taking your drugs correctly. Remember, 50% of the people that get their prescriptions don't even get them filled. And 30% of the people who do get them filled take them incorrectly. Meet with a physical therapist. And we're going to pay for this for you. Meet with a dietitian. And here's what they saw after first year. They saw a 95% satisfaction rate. They saw a 50% drop in absenteeism. So that meant what happened in the workforce. Production went up. The cost savings per participant was an average of $600 per person. At the end of 10 years, the cost per year savings for that population from the company standpoint, or the city in this case, was $3,600. At the end of 10 years, they looked at all their actuarial data, and they established that those who were on the program cost them the exact same amount of money, and they had a disease, diabetes, that was costing them the most money, versus those people who did not have a disorder and who did not participate in the program. Their cost was exactly the same. So Memorial Mission said, we're going to take this program on. So we're going to look at diabetes, asthma, hypertension, and mental health. So here is the largest employer of Western North Carolina says, we're self-insured, we got reinsurance through a company, but it's costing us millions and millions of dollars to insure people. How can we lower our costs? That impacts our bottom line. The same thing that I think that the federal government should do. Because ultimately, you got one of two choices. You borrow the money from China, Japan, India, and other countries. To be quite frank, the way the Bush administration did for the last 8 years. They put us in a tremendous amount of debt. Greatest debt that we've seen in our nation's history ever. Borrowed more money than all the other presidents who have ever served before him combined. Put us deeper in debt. Or we start taking control of the costs and the expenses, and encourage people to do that. Memorial Mission, their health care costs did this. When everybody else's in the country was going up, their cost was going down. This year, after this is their 5th year in the program, this is the first year that their health care has actually gone up a little bit. And when I said a little bit, it was like in a small single-digit percents, when everybody else is going up 16, 17, 18%. Now, and they made rules, they made exceptions to those who couldn't participate in the program. To me, those are the ways that we can curb the cost of health care and make sure that everybody's provided. And I would go to the extent of saying this, that we've got programs that are already in place. Medicare, Medicaid are already in place. So why would we have to recreate and restructure another bureaucracy that's going to cost us millions and millions and billions of dollars? That's the area in which we've got to make some significant changes. Yes, sir.
Being a lifelong resident fan, it's a great pleasure to meet you and talk with you.
Thank you.
And I have a couple questions. We were just talking about the reduction of healthcare costs. One of the things that I've noticed is that not very many people talk about this, and it's kind of sad, really. But tort reform so that the doctors who do get sued for malpractice don't have to get sued for as much money, and so reduce the need for malpractice insurance, thereby doing this to the costs.
Well, the Congressional Budget Office said that was $70 billion, between $50 and $70 billion in savings. So that was another area that we could actually put some programs in place that would actually reduce the health care costs. The overhead cost was not put in place, though. There was, Bart Gordon actually offered that amendment in the committee. And of course, there was nothing made in order on the House floor before the bill within the that's a perfect example. Antitrust is another example. Now, part of it is we have to be very careful with that because not from the standpoint of we see that, but we have certain states that have already engaged, and California has a cap, Alabama has a cap, Texas has a cap, Florida, Maryland has one of the most stringent caps, Michigan has a cap. And so it's actually involved more than that. They actually seen that there was actually a relative relationship, believe it or not, to the cost when a physician had a child in college. That there was actually more times that they would send someone for more treatment or more testing. So we have to be very careful with all the data. So we don't, that's just coming from, not from me. That's just a lot of the data that's been received. So we have to be very careful when we look at that. But we got to curb the healthcare costs. There's a lot of ways we can. Yes, sir. Right. All right.
For those of us who are involved with political science here in West Carolina, my first question is, when did you decide to become a When did you realize that?
I guess it would have been in 2000, late 2000, 2005, mid-2005. It was one of those things that my wife and I were working on a charity that we were doing together. I don't know, are there any New Century Scholars in here? You're a New Century Scholar? That was one of the programs that my wife and I worked with, and certainly the kids who went to Swain County that we worked on and helped provide some funding for. And we were working in every place I went, and I was telling people about some things I wanted to do from a foundation standpoint. Everybody said, oh, you ought to run for office. I'd never intentioned. There's two things I said I'd never do. One would be a part of the media, which I did some commentating. The other was I said I'd never run for elected office, and I've done both. So I always was never say never. Watch what you say. So in that, it's a way to give back. It's a way to give back to the community. That's and my Luke Hyde's here from Bryson City, where I grew up, and there was whether his brother who was elected official, Luke actually participated and gives so much to our community in Bryson City now. It's a way to give back to people giving back to you, and it's didn't serve in the military. I'm not saying this is no stretch serving in the military, the honor that we owe our veterans. But this is a way to give back to your country is to serve.
The second part of the question was, before you became a public steward, what have you done prior before you were involved in the university or Western and other schools that allowed you to excel in that office, your pursuits of each one? What did you do in your, number of years that brought success to transition?
Yeah, it's I would have to say work ethic probably more than anything. Having goals to obtain in your life, whether it be to play college ball and to get a scholarship. My dad was a mail carrier, so he told me, he said, if you're going to go to college, you're going to have to either pay your own way or get a scholarship. And so I started working, had my own businesses when I was in high school. I run a car wash called Mr. Clean's Car Wash and Wax. Quite funny, but it paid the bills in high school and college, and so it was a work ethic and leadership. If you work hard, you become a leader, and sometimes you naturally fit into it. And my successes in college were a lot better than successes in the NFL. We didn't win a lot of games, but I was asked to be the captain of the New Orleans Saints, which is a great thing to say now that we're winning. But at the time, we weren't very good. To be behind one of the great, my co-captain was a guy named Willie Rowe. Received the Ed Block Courage Award from the players in the NFL, and just kind of having that both physical and mental toughness. And then just being an entrepreneur and going through the processes and understanding and leading. We started out with my brother and I running a company, and after a couple of years, we had over 200 people that worked for us. And it was those type of just leadership skills. And then when you get in Washington, it's the same thing. You're there with all leaders. Everybody there is a leader in some aspect. And in my first year, I was nominated to the National Prayer Breakfast, the chairman of the National Prayer Breakfast. And I don't think there's ever been another freshman nominated in that position. And then in my second term, being one of the leaders of the Blue Dogs, it's voted on by